Have you ever wondered what actually happens if you or someone you love gets diagnosed with breast cancer? It's a scary thought, for sure, and one that sends a shiver down most of our spines. But knowledge is power, and understanding the journey can make it feel a lot less like a terrifying unknown and more like a challenge that can be faced head-on. So today, let's walk through this journey together, step by step, to demystify what happens after a breast cancer diagnosis. It all starts with a sign. Maybe it's a lump you feel in the shower, a change in your skin, or something unusual you notice. Or perhaps it's something found during a routine mammogram. Whatever the trigger, the first step is usually a visit to your doctor. They'll perform a clinical breast exam and ask you about your medical history. If they suspect something might be wrong, they won't jump to conclusions. Instead, they'll recommend further tests. This is where imaging comes in. You might have another mammogram, which is a more detailed X-ray of the breast. An ultrasound is also common. It uses sound waves to create a picture of what's going on inside. In some cases, an MRI might be used, which gives an even more detailed look at the breast tissue. These tests help doctors see the size and location of the abnormality. But even with these images, they still can't be 100% certain it's cancer. To get a definitive answer, a biopsy is needed. This sounds a lot scarier than it usually is. A doctor will take a small sample of tissue from the suspicious area. This is typically done with a thin needle and is a relatively quick outpatient procedure. The tissue sample is then sent to a lab where a specialist, called a pathologist, looks at it under a microscope. This is the moment of truth. They will determine if cancer cells are present. If the biopsy comes back positive, it means cancer has been found. This is an incredibly difficult moment, and it's completely normal to feel overwhelmed, scared, and confused. This is when your support system, your family, friends, and your medical team becomes so important. You are not alone in this. Your doctor will likely refer you to a team of specialists who focus on breast cancer. This team can include a surgical oncologist, a medical oncologist, and a radiation oncologist. The next step is crucial: staging the cancer. Your team needs to figure out the specifics. How big is the tumor? Has it spread to the lymph nodes under your arm? Has it traveled to other parts of the body? To find out, you might have more tests, like a CT scan, a bone scan, or a PET scan. The results of these tests will determine the stage of the cancer, which is typically numbered from 0 to 4. Stage 0 is non-invasive, while stage 4 means the cancer has spread to distant organs. The stage helps your doctors create the most effective treatment plan for you. But staging isn't the only piece of the puzzle. The pathologist will also analyze the cancer cells from the biopsy to understand their characteristics. They'll look for things called hormone receptors, specifically estrogen and progesterone receptors. Once all this information is gathered, your medical team will sit down with you to discuss a personalized treatment plan. It's not a one-size-fits-all approach. Your plan will be tailored to your specific type of cancer, its stage, your overall health, and even your personal preferences. The main goals of treatment are to remove the cancer, prevent it from coming back, and keep you as healthy as possible. Let's talk about the common treatments. Surgery is often one of the first steps. There are two main types. A lumpectomy removes just the tumor and a small margin of healthy tissue around it. This is also called breast cancer-saving surgery. The other option is a mastectomy, which is the removal of the entire breast. The type of surgery recommended depends on the size of the tumor, the size of your breast, and other factors. During surgery, the surgeon will also likely check the lymph nodes under your arm to see if the cancer has spread there. After surgery, many people receive additional treatments, known as adjuvant therapies, to kill any remaining cancer cells and reduce the risk of recurrence. One of the most well-known is chemotherapy, or chemo. Chemo uses powerful drugs to destroy fast-growing cells, including cancer cells. It's usually given through an IV in a clinic, in cycles, with rest periods in between. Chemo can have side effects like hair loss, nausea, and fatigue, but there are many ways to manage these today. Another common treatment is radiation therapy. This uses high-energy rays, like X-rays, to target and destroy any cancer cells that might have been left behind in the breast or lymph nodes after surgery. It's like a highly focused beam of light targeting a specific area. You'll typically go in for short daily sessions over several weeks. Radiation is painless during the treatment itself, but it can cause skin irritation and fatigue over time. Now, remember those hormone receptors and HER2 status we talked about. This is where targeted therapy comes in. If your cancer is hormone receptor positive, you might be prescribed hormone therapy. These are often pills you take for several years that block hormones or lower their levels in your body, essentially starving the cancer cells. If your cancer is HER2 positive, there are specific drugs that target the HER2 protein, stopping the cancer cells from growing and dividing. These targeted therapies are often more precise and can have fewer side effects than traditional chemo. And then there's immunotherapy, a newer and incredibly exciting field. This treatment works by boosting your own immune system to help it recognize and fight cancer cells more effectively. It's not used for all breast cancers, but it's becoming a powerful option for certain types, especially triple-negative breast cancer. Throughout this entire process, managing side effects and focusing on your overall well-being is key. This is called palliative or supportive care. It's not just for end-of-life care. It's for everyone, at any stage of illness. It includes managing pain, nausea, fatigue, and anxiety. It can involve nutritionists helping you eat well, physical therapists helping you regain strength, and counselors helping you cope with the emotional roller coaster. It's about treating the whole person, not just the disease. The emotional and mental journey is just as real as the physical one. A cancer diagnosis can bring up a storm of feelings. It's so important to allow yourself to feel them and to seek support. Talk to your family and friends. Join a support group, either online or in person, to connect with others who truly understand what you're going through. Many hospitals have social workers and psychologists who specialize in helping cancer patients. Remember, taking care of your mental health is a critical part of your treatment. If you ever feel overwhelmed or hopeless, please reach out. There are crisis hotlines and mental health professionals ready to help you navigate these feelings. You are not a burden, and asking for help is a sign of strength. Life after active treatment is often called survivorship. This phase brings its own set of challenges and joys. You'll have regular follow-up appointments with your oncology team to monitor your health and check for any signs of recurrence. This might involve physical exams, blood tests, and imaging scans. It's a new normal. You might be dealing with long-term side effects or the fear of cancer coming back, but it's also a chance to reclaim your life, to find new meaning, and to focus on living well. Many survivors find new strength and a new perspective on life. In some cases, if the cancer was stage 4 at diagnosis, or if it returns and spreads, the focus of treatment may shift. The goal becomes managing the cancer as a chronic disease, controlling its growth, relieving symptoms, and maintaining a good quality of life for as long as possible. Advancements in treatment are helping people live longer and better with metastatic breast cancer than ever before. The journey through breast cancer is a marathon, not a sprint. It's a path with twists, turns, and unexpected hurdles. But it's also a path that is walked by millions, supported by dedicated medical professionals, and illuminated by ongoing research. From the initial diagnosis and staging, through a personalized treatment plan of surgery, radiation, chemo, and targeted therapies, to the emotional healing and survivorship, it is a comprehensive battle fought on many fronts. The most important thing to remember is that you are the center of this journey. Your voice matters. Ask questions, understand your options, and be an active participant in your care. And above all, know that there is a vast community and a wealth of resources available to support you every single step of the way. Hope is a powerful medicine, and today, there is more reason for hope than ever before. Thank you so much for watching and for taking the time to learn about this important topic. If this video was helpful, please give it a thumbs up and consider subscribing for more content that empowers you with knowledge. Stay healthy, stay informed, and we'll see you in the next video.